Dr. Ding, you tweeted, hospitals completely overwhelmed in China ever since restrictions dropped. Epidemiologists estimate more than 60% of China, 10% of the Earth's population likely to be infected over the 90 days. Deaths likely in millions, plural. This is just the start. Your tweet has gone viral. Are you being alarmist once again? Or do you think this is a new reality the world must contend with, especially China?
Well, thank you for having me. I want to point out that, when the Delta wave swept through India and when many of the Omicron previous waves swept through Europe and America, most of the people were infected, right? And so affecting 60% of a population, if you don't have restrictions, is very possible, and we've seen it time and time again. And if we know that 800 million people are going to get infected in China, then saying there's like 1 to 2 million deaths is very, very low in proportion. And we can easily see that because China does not have really, really strong vaccines. Its vaccine coverage is very poor in the elderly, especially boosters. And in this day and age, if you don't have boosters, your protection is very low. China does not have many Paxlovid drugs. And in mainland China, the per capita hospital beds and doctors and nurses is much lower than in Hong Kong and other places where once they lifted restrictions, we saw very, very high mortality rates. So there's no reason to think that the same thing won't happen in mainland China. Now, of course, the only thing that could stop that would be if the government reversed its policies and went back into much more strict rules, but I don't see that happening. So I'm worried that, and many epidemiologists are worried that this is easily, you could see millions of deaths and hundreds of millions of infections over the next 90 days.
Are you therefore suggesting that this is primarily because restrictions were lifted as China decided to abandon a zero COVID policy? Are you also suggesting maybe, as some fear, that there could be a new variant that is not just in China, but is also possibly now in other parts of the world, like the US, Japan, South Korea, which are witnessing again a rise in COVID cases?
Yeah, it's a combination. So first of all, variants are emerging at a very rapid pace. Previously we had a new variant every 6 months and then every 3 months. Now we have new variants almost every month. And now we have variants on top of new variants. And China does have variants such as BF7, which is evasive, and also a little bit more severe. The US has BQ variants, BQ1s. But the thing is, when you have a virus go through 800 million people, there's bound to be newer and newer variants. So that's a real concern because each of the variants are becoming more, they're being trained to be more vaccine and previous infection evasive. And that's inherently the problem. And of course, restrictions. China's lifted some restrictions, but not like Western lifting of restrictions. I would say China has lifted about halfway between where it was before and where it is in the West. But it's still, given how evasive and infectious Omicron subvariants are, I think that's the double whammy. Lifting restrictions plus poor past immunity, poor vaccination, and new variants. This just bodes very poorly for China.
You've said doubling time in China may not be days but hours now. Quoting some epidemiologists. In India, interestingly, numbers at the moment are at their lowest. Again, I ask you, are you being alarmist when you suggest that China now could simply go out of control?
Well, yeah, the doubling in hours, that was someone else who said it. I think it's possible within certain cities. If you don't have restrictions, that is possible. But we can't know for sure because I said in my tweet that it's hard to pinpoint that because it's hard to do testing that fast. But I also want to point out, Delta variant, when it hit India, if you remember, and I'm sure you do, in April, May, June of 2021, people who were saying COVID will hit India were not being alarmist. A lot of people who were saying that India will be hit hard, or who would say, oh, India was a herd immunity. But we saw what happened in April, May, June of last year. So we should not be arrogant in that sense because, yes, India has already had an infection wave, but China still has not. Mainland China, if you look at the per capita case rates, are very, very low. And in certain ways that's good, but in certain ways it also makes them vulnerable. So if you don't think that what happened in India could happen again in China, then obviously you can disagree. But we know what happened in India, and I worry for the people of China right now.
So are you saying, therefore, net, this is a problem specific to China at the moment? The rest of the world need not worry at the moment about another surge or another variant out there that could be potentially infectious and fatal?
I wouldn't say need not worry too much. I would say that they won't be hit as hard as China is, because China is almost virgin territory for not having previously been infected, right? India's already had a burn through, because India's burn through, as you know, was very cataclysmic last year. Now, the issue is these variants, like, they cause huge numbers of reinfections. And the question is, of course, how bad will it get? Like in the U.S., we're already seeing hospitalizations rising, deaths rising again, as well as in Europe, hospitalizations and deaths are rising again. Not as bad as before, but they're still rising, especially since we've only started winter. Actually, we haven't even officially started winter yet. So we are still, I think, not in the clear in any ways. It's just China will have a really, really bad burn through that many Western countries saw in spring of 2020. And India saw it of spring of 2021.
Okay.